Yes, you're welcome to the show Health Matter every Saturday. Every Saturday, where we dey waiting? Where would they bring Dr. Bat come for the show to come enlighten us on how to stay healthy, on how to take good care of ourselves? Because like something I just read now in the passing before we enter the show, they say take good care of yourself. Oh. Because if you fail to take good care of yourself, nobody go help you. In fact, it go shock you. Say irony of life, people fit drive 100 miles to come person burial, but when it comes to crossing the other road to help you, they fit no dey available. Meaning say if you no use your face mask, if you no protect your children, if you no wash your hands, nobody go help you do am. You have to just help yourself to stay alive. On top of that, I'll say a good welcome to Dr. Bajo. Welcome to the show, sir.
Thank you very much, Chief.
You're looking good.
Thank you very much, sir.
You're welcome,
That was
sir.
a
We
good
missed
one.
you last week.
Thank you very much. It's all about taking responsibility.
Yes, yes.
Good morning, viewers at home and around the world. We are happy to be back today on Health Matter on WAP TV. This morning, we'll be looking at a topic we started some few months ago, coronavirus pandemic. Coronavirus pandemic. And we'll be looking at a number of subtopics where we, as of today, in terms of global affectation, in terms of the affectation in our African continent, and of course, our country, Nigeria. I would like to start by reading out an illustration that was credited to the former Director General of NCDC in the United States, Dr. Tom Frieden. He says, it took the world about 100 days to go from 0 cases to 1 million detected cases. Then 1 to 2 million in 12 days. The period of time it took the world to hit that mark. 2 to 3 million happened over a period of 13 days. 3 to 4 million happened over a period of 12 days. And of course, 4 to 5 million happened over a period of 11 days. 5 to 6 million happened over a period of 10 days. 6 to 7 million in 8 days. 7 to 8 million in another 8 days. And then finally, 8 to 9 million happened over a period of just 6 days. And of course, that is where we are today. Global affectation at the moment stands at about 9.9 million persons, individuals, have been affected by this scourge. And out of this figure, nearly 500,000 people have lost their lives. And about 5.3 million individuals have equally survived from the scourge. In other words, the global death percentage stands at about 8% at the moment, while the recovered cases stand at about 92%. And of course, that brings us to the fact that 80% of people that may be affected by COVID-19 may actually have little or no symptoms to mild symptoms. They may not be hospitalized. They may not need to be treated in a hospital setting to recover. The body will be able to achieve clearance of this virus over a period of time. But 20% of individuals that may be stricken may not be that fortunate. A fraction of those 20% may end up with severe disease, and of course, some of them may end up with critical illness. And this morning, we'll be looking at all of that. Also, I want to point out that over the last 24 hours, Nigeria recorded 684 new cases. 684 new cases, bringing the total confirmed cases in Nigeria to 23,298. You can see that on our screen. And of course, Nigeria has successfully treated and discharged 8,253 individuals. And unfortunately, too, 554 persons were unable to make it. They died as a result of this scourge. The figures are not anything different in some of the African countries around us. At the moment, South Africa is on the top of the African list or chart, if you like. The total cases affected in South Africa at the moment stands at 124,590. And the new cases they had in the last 24 hours was 6,215. And the number of people who have died in South Africa at the moment stands at 2,340. And new deaths was 48 people. And we have the statistics for South Africa on our screen at the moment. Now, if you take a good look on that statistics, you will discover that South Africa has actually tested far beyond any other country in Africa. They've tested 1,493,104 persons have been tested in South Africa. Basically, the number of people that have been tested in South Africa is almost about 1.5 million. That's a massive achievement. And little wonder they've been able to discover 124,590 positive cases. And out of this figure, 64,111 people have equally recovered. And of course, as we said before, 2,340 people were unfortunate. They did not survive. Recall that this coronavirus actually started in Wuhan, and it started in China. And at that time, China was the epicenter. But look at how time flies. As we speak now, on the global list, China has dropped to about 22 on the list. As a matter of fact, South Africa has gone above China. South Africa is currently on number 18th of the global list. And we actually have 2 African countries that have gone into the first 25 most affected countries in the world. South Africa is seated at number 18, while we have Egypt at number 24. Egypt currently has 62,755 infected individuals. The new cases they had over the last 24 hours was 1,625. And of course, Egypt tops the chart in terms of fatalities, the number of people that have died from this scourge. 2,620 people have not survived in Egypt. So you discover that the rate at which the pandemic is sweeping across the world, initially we were seeing all of this in other countries of the world, but we are beginning to witness that in Africa as well. So what is it that we are not doing right? Is it that we have lost our guard? Is it that we are no longer complying with some of the directives, the protocols of prevention that government has given out to the masses? Of course, you and I know that of a truth, there are a lot of things that we are not doing right at the moment. That takes me to the use of face mask or cloth face mask. You discover that a good number of Nigerians at the moment are still walking about out there in the public domain without using face mask. Some who have the face mask on will have it either below their chin, above their forehead. Some will have it permanently down anytime they want to speak. Some will even make an attempt to take it out anytime they want to sneeze or cough. And you begin to wonder, what purpose do you think this face mask was meant to serve? Ab initio. You also discover that a number of government functionaries, when they want to speak in a gathering, and of course, you need to raise your voice so that people can hear you. And in the process, there is no way that you can speak without releasing some droplets. The face mask is actually meant to cover your face even when you're speaking with the microphone, even when you're talking in the public domain. And we are beginning to see people who will wear face shield without face mask, and they think that is enough. Of course, NCDC has told us that is not enough. Ministry of Health has also shown us, we have an infographic that is showing on our screen at the moment. If you're putting on a face shield, usually for our women, because they wouldn't want their makeup to be tampered with when they put on a face mask or a cloth mask, they would prefer to just put on the face shield. If you're doing so, keep in mind that you're compromising your health. The proper way to use it is to ensure that once you have your face shield, you must also wear your face mask in order In other words, you need to prevent the droplets that are leaving your mouth, usually when you speak or when you sneeze or cough in a gathering where you have other individuals around you. And of course, I also want to point out that in the last couple of days, the NCDC has actually given us an advisory on how to wear both cloth mask and face mask. They've also told us who should wear face mask, and there are, of course, some instances where non-medical workers are allowed or advised to wear face masks. Don't forget, any moment from now, home treatment for infected COVID individuals will commence in Lagos State. And of course, people who are going to be nursing or going to be living with such individuals that are infected will need to be on clothes, on medical face masks, not just cloth face masks. If you're an elderly individual, we have heard that from WHO, and you're over 65 years of age, and you have a pre-existing medical condition or an underlying medical condition, you also will need to wear a medical face mask. Now, it is not all doom and gloom with COVID-19. In the last couple of weeks, we got an encouraging news, an encouraging discovery, a breakthrough that a drug has been discovered that can actually help to reduce the mortality in critically affected individuals by a large chunk, by a large percentage. As a matter of fact, I'm talking about dexamethasone drug. Now, dexamethasone can occur in form of an injection or a tablet. It's easily available, and it is also cheap. Okay? Now, a study was carried out by Oxford University in the UK. The sample size was beyond 6,000 patients, so it was quite an elaborate and robust study. And it came out with these findings, that this dexamethasone drug has the capacity to reduce death rate in patients who are critically ill or severely ill. Critically ill or severely ill individuals. In people who are on mechanical ventilators, who will need a respiratory support, it can reduce the mortality in such group of persons by as much as 1/3. In people who may just need oxygen supplementation is a situation where somebody is unable to breathe properly without assistance. Such an individual, you will need to put the person on oxygen, usually intranasal oxygen. Okay, so people who are on oxygen supplementation, this drug has been found or has the capacity to reduce mortality rate in such group of persons by 1/5. Meaning that if you have 20 people who are so afflicted, it can actually help to save 4 persons among them. And of course, that is a major breakthrough. Also,
Dexamethasone.
yes, dexamethasone is the drug.
Yes.
I will also want to chip in an advice at this point. The drug can equally be harmful. It can equally be harmful if people who have mild disease without prescription go ahead to use it. So even as you're getting this good news, it's not for you to go and probably get to a pharmacy and buy the drug and start using. If you do that, you're endangering your health. Now, why it is so, I will give a medical explanation to why it is so. What happens? A little bit of pathophysiology of what happens when one is infected or when one has when one is infected with COVID-19. What happens is that your immune system will try to mount a response
against this antibody.
Yes, against the COVID-19 virus that has gone into such a person's system. So the immunity will try to mount a resistance, will try to fight back. Some people will be fortunate enough, their immunity system can actually handle that and ward off the infection properly. And those set of people will have little or no symptoms, and they will, of course, they will survive. Their immune system will be able to suppress and clear the virus from the system. Now, but some set of people who may have severe disease, what will happen is such people, in such persons, is that at that stage, the immune system may have been overpowered in such a way that it won't be able to combat the challenge or fight off or ward off the infection. Now, in such a situation, the immune system can actually go into overdrive, and of course, it will start attacking the body itself. And that is what causes the damage that we usually find in the lungs. That is at that stage, such individuals, the actual explanation for that is called the cytokine storm. Okay, so that's what I'm trying to explain. At such a stage, those are the group of patients that will require or that will benefit from oxygen supplementation, that will benefit from mechanical ventilation. Okay, now those set of patients are the ones that these drugs can benefit. So it needs to be properly timed.
Okay, I think on that we have to pause the doctor a bit so that we'll go on this shikini break, simply because doctor don't give us enough as far as this COVID-19 dey concerned. We self make we come back, open phone lines, make we come ask am all the things we no really dey clear for our mind. On top of that, let's go on this shikini break. We will be right back. Go nowhere.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit also advertise your product and services on top we show wey dey help people. Terms and conditions apply sha o.
Hello, today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water-absorbent, and the mid-layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19. Medical masks should be worn by health workers and those caring for someone with COVID-19 symptoms, persons aged 60 and over, and anyone with pre-existing medical conditions, as they are at greater risk of developing serious illness. and people who have symptoms suggestive of COVID-19. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged. Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. Now, how do you take off a medical mask? Before touching the mask, once again, ensure that you clean your hands with alcohol-based hand rub or soap and water. Remove the straps from behind the head or ears without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for single use only. Discard the mask immediately, preferably into a closed bin. Clean your hands after touching the mask. Always be aware of the condition of the mask. Replace it if it gets soiled or damp. A mask alone cannot protect you from COVID-19. It must be combined with other measures, including maintaining at least 1 meter distance from each other, washing your hands frequently, and avoid touching your eyes, mouth, and nose while wearing a mask. Stay safe and help prevent the spread of COVID-19.
Yes, most definitely. You're welcome back to the show. You don't see as Dr. April Bola, as she don't show us how to wear the mask, the kind of masks available. Talk of say this mask self, you get as they produce them before if you talk say this thing where they wear na fabric masks. No be say make any tailor just do anyhow masks, but all join make we shall try make we use mask. Now be the first step. And I have some questions for Dr. Bat here, which I would like to start with the issue of the weather. Dr. Matt, Dr. Bat, weather. We don't enter the rainy season. The rainy season is around the corner. I'll make I even talk say it don't come. Doctor, what is our fear vis-a-vis COVID-19? Or weather has nothing. I mean, absolutely nothing. This wet, or make I call it cold, tabi rainy season has absolutely nothing to do with COVID-19. That's the first question, sir. The second one, we have talked about the testing in South Africa. Vis-a-vis, what is happening with testing in Nigeria? How far have we gone or are we doing presently? So those are the two questions I have. While we open the phone lines for our viewers to also call, ask any question where they do their mind yaga as far as COVID-19 they concern. Okay, doctor.
Thank you very much for those wonderful questions.
You're welcome.
I'll choose to start with the second one, sir,
Okay.
if you don't mind.
No, don't.
Yeah, thank you. At the moment, Nigeria has tested more than 125,000 persons in the country. Precisely 125,090 people. Okay, we have that on our screen. As of this morning, okay, confirmed cases, we already know, 23,298. Now, still talking about testing, I also want to point out that at the beginning, when this COVID-19 actually came to Africa, the first time he entered Africa was on February 14th this year, on the Valentine's Day. That was when the first case was recorded in Africa. At that time, it was only 2 countries in Africa that had the capacity to test for COVID-19. In Nigeria, I think it was about only 2 or 3 molecular laboratories that have the capacity to test for COVID-19 at that time. But all of that have changed. At the moment, we have about 39 molecular labs scattered all over the country that can conveniently and independently test for COVID-19. That accounts for the reason why we are beginning to see a large number of infected cases being reported on daily basis. Now, there was a newly introduced, I choose to call it a game changer, if you like, gene experts machines that we have had in the country that was previously being used to test for tuberculosis and other diseases have been converted now to test for COVID-19. The last one that was activated was in Kaduna. So we have gene experts machines that can equally test for COVID-19 at the moment, alongside the previous methods that were being used. So Nigeria is trying to do a catch-up without a doubt. There are also no gainsaying the fact that the more we test, the more we will be able to discover, just like what is happening in South Africa. I dare say that other countries are having similar challenges. Some health officials in the US, I read something about it earlier hours of this morning, were actually saying that the numbers they have in the US, 2.3 million, that the true picture they have in the US may be about 10 times higher than the 2.3 millions that have been reported or documented. And of course, I can say that for Nigeria, that the number of reported cases we have now are equally being underreported because we haven't been able to test as many as we should be doing, but all of that are beginning to change. I also want to say that, talking about the other African countries, at the moment, all African countries can conveniently test for COVID-19. WHO gave that revelation sometime last week. So all the African countries can now test for COVID-19. So none of the African countries has to depend on another country to help out in terms of testing for COVID-19. So a lot of countries have actually ramped up capacities, have actually improved their medical infrastructures to meet up with the rising challenges that we're having with this COVID-19 contagion. Now, coming to your second question, the weather obviously will complicate issues. We do know that with rainy season, at least in our environment, there will be a rise in the number of cases of respiratory infections. You expect to see infections like common cold on the rise, catarrh, that a lot of people will have from time to time, seasonal flu, if you like, cough, as well as cough. And of course, I also would like to point out that these disease entities have a lot of similarities with the presentation that can be found in COVID-19. Added to that is the fact that we are beginning to ease the lockdown. We are beginning to open up our economies. And of course, going by the experiences we have seen in other places, other parts of the world where they've opened up their economies, they started noticing a sharp increment in the number of figures of the newly infected cases. It has happened in a number of countries. I think China has actually tried to institute a lockdown in a number of cities in trying to still curtail the spread of the disease. So the challenges are going to be enormous when the economies are fully opened up, coupled with the fact that we are getting into the rainy season. So it's going to get more complicated. I'm also happy to announce that apart from the molecular laboratories I've talked about that are currently 39 in number, Lagos State government has also announced, just yesterday, the Honorable Commissioner of Health, Professor Aki Abayomi, announced that about 7 private labs will be coming on stream by next week. They've done the validation, they've done the accreditation. And of course, that will give us another avenue so that a lot of Nigerians will have an opportunity of getting tested. And of course, I also want to see, as an individual, I want to see the turnaround time that it takes to get a result for COVID-19 reduced. If we can have it reduced to, say, 6 hours to 12 hours or just one day, it will make a whole lot of difference. It will make a world of difference in the management of COVID-19. Because what is currently happening in the country or in Lagos State, for instance, is that a number of patients who are acutely ill, who show signs and symptoms of COVID-19 are being denied care, critical care, on account of not having a COVID test result. And nobody is to be blamed. I've said it on a number of times on this program that the instructions from the government agencies are not clear-cut enough. You can imagine a situation where you've told unaccredited hospitals not to get involved. And of course, there is no avenue through which these hospitals can actually differentiate between who has and who does not have.
Sorry, sir. Let's quickly take Daniel. Good morning, Daniel.
Hello, good morning, sir.
How is Rivers this morning?
Rivers is wonderful.
Okay, Daniel, your question for the doctor.
Please, I just have a question for the doctor. Sir, no offense, but right now, they say we have 23,000 cases, but I just have a question. Is it that the ones that they discharge, there's a special medicine that was used to treat them, or is it that their immune system is stronger than the virus, or something is happening? And the ones that are dying, is it that their immune system is weak, or the drugs that they are using for people they discharge is not working on them?
Thank you, Daniel.
Thank you very much, Daniel.
You got the question, right?
Yes, I got the question. Now, let me say this. I talked about it briefly at the beginning. A good number of people that will recover as a result of how robust their immune systems are. For people who, the number of medical conditions that one could have that we can refer to as risk factors. And this, of course, include people who may have underlying medical conditions like diabetes, hypertension, acute chronic kidney diseases, and asthma, and a number of other diseases. Anybody who has such a medical condition is at a disadvantage. And that is why we are insisting that people like that, ordinarily, they should, apart from keeping to social distancing and other preventive protocol, people like that, expectedly, it will not be out of place if people like that should be going with the medical mask, okay, because of the higher risk of exposure that could come to people like that. Now, beyond the people that may have the medical conditions that I've mentioned, we also do know that the elderly are equally vulnerable.
Yes,
they can easily become infected. We have had cases of people, the elderly, who probably didn't leave their houses, and of course, just because they have domestic staff in the house that often go out and come in the process, they ended up infecting those elderly ones. The people who infected them may actually not have a severe disease. They can easily go ahead and, of course, over time survive, even without getting hospitalized. But the elderly people that may be unfortunately infected may have a different story to tell. Those ones may not survive. In terms of the treatment that may be given to this individual, before now, until last week, when this news about the breakthrough of the dexamethasone came out, there was actually no form of treatment or cure for COVID-19. Basically, what is done for people who are being treated are symptomatic management. If the person is having challenges with fever, you do something to curtail the fever. If the person is stooling and vomiting, you rehydrate the person and then see what you can do to stop the vomiting, while you allow this individual to recover on his or her own over time.
Okay, doctor, before we continue, let me quickly ask you these two questions. One, what is, yes, you as a doctor, I know you definitely know, so we need you on this, but let's take Sadiq first. Sadiq, good morning.
Yeah, hello, good morning.
How are you doing, Sadiq?
I'm fine. Well, how is the weekend?
Going fine. Your question,
We
please.
really appreciate your effort for enlightening and educating Nigerians about the issue of COVID-19 and other health-related matters.
Thank you.
Thank you very much, Mr. Sadiq.
Yeah, thank you, doctor. Please, my question, I'm the person that asked a question last week about whether if someone can get infected after recovery. But my question this week is that can someone get infected without knowing, without any symptoms, and get fully recovered without any symptoms from him or showing any symptoms, and get fully recovered?
Thank you very much. I must say that your questions are always technical, sir. Thank you very much for that wonderful question. Now, people can get infected without knowing that they've been infected. It can happen. Someone can actually get infected, get exposed to the virus, get infected, and not have any symptom. Of course, we know we've talked about asymptomatic carriers. We've talked about pre-symptomatic carriers and, of course, symptomatic carriers. Asymptomatic carriers are people who get infected and may not show any symptoms all through the duration. But what will happen is that for such people, if they get tested in the future, we say antibody testing method, you discover that such a person could test positive when antibody testing kit is used for such an individual. Now, what it means is that the person, it could mean one of two things. It could mean the person has an active disease. It could also mean that the person has been exposed in time past, but no longer have an active disease. So that can happen, okay? So that is why some countries are beginning to use it. Britain, for instance, they've employed such methodology in trying to test for a larger chunk of their population. So to see the people who have been unduly exposed that may not have come down with the disease. Samuel from Plateau.
Samuel.
Good morning,
Samuel. How are you doing, Samuel? Sam, if we have you there, can you speak up, please? I don't believe Sam is gone. So, doctor, before we go sharply, it's never too much to mention what are the food we can consume to boost our immune system. What are the things we can do? Because that's the only way out now. I know you don't talk am before, but we know fit stop to the talk am. What can we do, sir, to, boost our immune system?
Yes, basically what we need to do to boost our immune system, number one, in terms of food, we need to eat a balanced diet. Our diets need to be balanced, okay? You need to eat a diet that will have the major classes of food in the right proportions, okay? That's one. Number two, we have found out that one of the risk factors that actually could make someone to have a disadvantage with COVID-19 is vitamin D deficiency. So all of us that live in this part of the world, I don't think that will pose as a challenge because we have abundance of sun. That is only one vitamin that you can actually get by just coming out in the early morning sun. Okay, so we have abundance of the sun, so we need to expose ourselves to this sun so that we can update and, of course, ensure that we have this vitamin in our system. Other than that, the number of vitamins too that we can start taking, we have mentioned some of them before. Vitamin C could be helpful at a time like this. It helps to boost our immunity. Zinc too can also be of help. Okay, so these are some of the drugs that you may like to take. They are supplements, not for treatment.
Okay, thank you very much, Dr. Bat. We really enjoy this session with you, and we hope that next week will be better and bigger. Thank you, sir.
Thank you very much.
So our viewers will say thank you very much.
Yes.
Have a
See you again next week.